Good evening, everyone, and thank you for attending our COVID vaccine update webinar. I'm joined by Armida, who is a very amazing co-op student that we've had recently, and she'll be going over the latest evidence around booster doses and some of the recommendations across Canada, as well as counseling points for your patients around vaccine apathy as well. So it'll be a great review session around some of these important points for COVID vaccines, because as we know, and unfortunately COVID isn't going away anytime soon. Let's move on to the next page, Armina. Okay, so we'll do a quick introduction. My name is Molly. I lead the program development here at Whole Health Pharmacy Partners. I will be moderating the session for tonight. If you have any questions, please feel free to comment them in the chat box or in the Q&A, or if you're joining us on Facebook, please feel free to comment as well on our video. And we'll either get to them during the session or we'll have plenty of time at the end of the session as well for Q&A. As I mentioned before, I'm joined by Armida, who is a fantastic co-op student, and she'll be guiding you through the rest of the session.
Thank you, Molly, and hi, everyone. I'm Armida. I'm a pharmacy student at the University of Waterloo and very happy to have done my co-op here at Whole Health and can't wait to get started with this session. So this webinar was made possible with support from Moderna, who is supporting our educational seminar today. Moving on to the agenda. So there are 4 parts to the webinar today. First, we're going to discuss some updates on the approved COVID-19 vaccines, as there are some new ones that have recently been approved by Health Canada. As well, taking a look at some of our current vaccination efforts and where the numbers are with the vaccine uptake at this point in time. And then moving on to taking a look at the efficacy of boosters and some of the studies that have been done by the CDC and around the world about different boosters and their efficacy. And finally, ending off on what some next steps can be for pharmacists in COVID-19 prevention. As Molly said, unfortunately, the pandemic isn't going anywhere anytime soon, so it is still a push forward. So starting off with, and oh, my apologies, I skipped forward a section. So taking a look at update on approved COVID-19 vaccines, excuse me. Some new COVID-19 vaccines have been approved by Health Canada in 2022, as well as some new provincial eligibilities for 3rd and booster doses, and with 4th doses and 5th doses coming out as well. So we can take a look at some of these updates that were added to the continued vaccination efforts that are beyond the primary series. Oh, sorry, I don't know why it keeps jumping between the slides. Okay, so this is a summary of all the Health Canada approved COVID vaccines right now. This includes Moderna, Pfizer, Novavax, Johnson & Johnson, and Vaxzevria. It's currently recommended that a patient receive mRNA vaccine as their 2nd or 3rd dose if their previous doses were one of the viral vector or protein-based vaccines. So the mRNA vaccines, as indicated, would be the Moderna and the Pfizer vaccines. As well, you'll notice that the highlighted green areas show that the vaccines that are currently approved for a 3rd and booster doses, the Moderna and Pfizer mRNA vaccines. And they are both highly effective against COVID-19 infection, as you can see under the efficacy column, in both pediatric and adult populations. So Moderna did recently receive the Health Canada approval for pediatric populations as well, ages 6+. This will be the main focus of our presentation today as we move forward in ensuring high uptake of the third and booster doses. So those are the vaccines I'll be touching on the most. No vaccines are currently approved for use for children under the age of 5. So pediatric population would be over the age of 5.
And just as a reminder, I'm just going to jump in at this point, Arvita, just as a reminder to everyone that despite the fact that Moderna and Pfizer are indicated for ages 5+ or 6+, that doesn't mean that the boosters have been indicated for that age. So right now, within the NACI recommendations, most of the booster doses are from ages 12+ for those who are immunocompetent.
So taking a look at third dose and booster dose eligibility, a third dose or a booster dose of the COVID vaccine is now available in every province. And some provinces like Ontario even added a 5th dose for special populations today. So it's important to keep updated as the information keeps changing. The dark green bubbles here highlight provinces that are offering a third dose for all individuals over the age of 12, as Molly mentioned, and for moderate to severely immunocompromised children, ages 5 to 11. So again, 5 to 11 immunocompetent children cannot receive the booster dose. And this includes Ontario, BC, Alberta, Saskatchewan, New Brunswick, Nova Scotia, Newfoundland, Labrador, and PEI. Some of those aforementioned provinces are also offering a 4th dose for youth and adults who are immunocompromised and other select groups who are at higher risk of COVID-19 infections and complications. These provinces are highlighted with the blue circle. And finally, the provinces highlighted with a yellow circle, so Manitoba and Quebec, are currently only offering third doses for adults 18+ and special populations, which include various at-risk individuals. Overall, booster and additional dose eligibility across the country has increased to include much of the general population, and pharmacists, of course, play a major role in continued support of these vaccination efforts.
And just another note on this slide as well, that these eligibility requirements are constantly changing as well in all of our provinces, right? So don't only refer to this slide. Please check with your local public health, your provincial public health, to make sure that your eligibility knowledge is the most up to date.
Thank you, Molly. As I mentioned before, on March 17th of this year, Health Canada approved Moderna's Spikevax COVID vaccine to be used in pediatric populations ages 6 to 11. Safety data of the Spikevax in children was collected in an ongoing phase 2/3 two-part randomized placebo-controlled and observer-blind clinical trial in the US and Canada. So the first phase was an open label phase for safety, dose selection, and immunogenicity. This included 380 participants who received at least 1 dose of the 50 microgram Spikevax. Part 2 was the placebo-controlled phase, and it included about 4,000 participants who received at least 1 dose of Spikevax or placebo. Participants with a known history of the COVID infection were excluded from the trial. And the participants were then randomized 3-to-1 to receive 2 doses of either Spikevax or saline placebo 28 days apart. In part 2, the median length of follow-up was 82 days after dose 1 and 51 days after dose 2. And immunobridging analysis evaluating the SARS-CoV-2 50% neutralizing titers and seroresponse rates 28 days after dose 2 was conducted in a subset of children ages 6 to 11 and participants ages 18 to 25. Subjects had no evidence of prior SARS-CoV-2 infection at the baseline, and the efficacy of Spikevax against the infection was already established to be 100% in the 18 to 25 age group. So the GMT of the neutralizing antibody titers and seroresponse rate in children aged 6 to 11 was comparable to that of the 18 to 25 age group. So ultimately, to summarize, with the new Moderna clinical trials establishing good safety and efficacy in the pediatric population, pharmacists now have more opportunities for vaccination and can now drive up the pediatric vaccination in their communities, especially as the efficacy in the 6 to 11 age group is comparable to that of the ages 18 to 25, which was established to be 100%.
Yeah, so I think a few people might have questions about this as well, especially with this new indication and the messaging with Pfizer vaccines being prioritized for pediatric populations. So it is still recommended within most of our jurisdictions here to prioritize the Pfizer vaccine for pediatric patients under 30 years of age. Due to NACI recommendations, due to the risk of myocarditis. Now, I think from what I hear, Armida, and let me know if you heard something more up to date as well, but it seems like the risk of myocarditis within the 6 to 11 age group is not well characterized, but so far they haven't seen a safety response or a safety signal.
Yeah, exactly. So while it is safe, the myocarditis and pericarditis risk was mostly established in the young adult age group and not so much the pediatric population, but the indication is still there for the pediatric population to be used. Now moving on.
And this is half the dose, right? 50
yes.
micrograms is half the dose of the original
yes.
Moderna.
It is half the dose. So the original dose would be 100 micrograms and for children it is 50. So moving on to take a look at our current vaccination efforts. Pharmacists have been at the forefront of the COVID vaccination program over the last year and two. A large majority of Canadian youth and adults are now fully vaccinated thanks to pharmacists, and the efforts have continued as pediatric, third, and booster doses have also been approved. Over the next few slides, we will take a look at the results of the current vaccination efforts and the public's uptake throughout this whole vaccination process. So taking a look at the population data, at how the vaccine uptake has been, recent Canadian data shows that the overall COVID-19 vaccination results as of March 27, 2022, 81% of the total population is fully vaccinated, which includes 2 doses as part of their primary series. 47% of the total population received an additional dose on top of their primary series. So this would be like a booster dose, whether that is a 3rd or a 4th dose, depending on what the primary series is for the patient. And only 39% of the pediatric population, that is 5 to 11 years old, are fully vaccinated. So we can see here that while a large majority of the total population is fully vaccinated with 2 doses, there still exists a gap in the booster and the pediatric vaccination uptake. And the uptake among patients in those groups is considerably lower. So pharmacists definitely can play a role here in their communities to increase the uptake. And for more information and day-to-day data, I recommend checking out the healthinfobase.canada.ca, as it shows the numbers and the vaccination and cases every single day. So taking a look at kind of the why behind the low vaccine uptake when it comes to boosters and pediatric doses, vaccine apathy could be a large contributor to the low uptake, and this can be defined as the public's disinterest in COVID vaccinations, especially as vaccination efforts and media and all the information surrounding the pandemic has continued for so long. It causes vaccine or health care information fatigue and apathy as it's continually repeated. So here we will discuss some of the ways that we can help our patients with their vaccine apathy and discuss some of the reasons why they might be feeling this way. Some of the primary factors driving vaccine apathy are listed on the slide here. Starting with adverse effects, some people experience adverse effects like joint pain, muscle pain, transient lymphedema after receiving their first and second dose, and because of that are now reluctant to book a third dose. And while patient comfort and the risk of adverse effects is highly a valid concern, it is important for healthcare professionals to provide solutions to addressing these adverse effects and engage in conversations regarding the pros and cons of vaccination, and also stress the greater risks of hospitalization and death that are associated with COVID-19 compared to vaccine side effects that are only temporary. Another potential driving factor is the use of the terminology booster, which may mislead some people to think that it is not necessary as it's not part of what is called their primary series. It's important to understand that while this may be a booster, immunity does drop significantly without a third dose, and I will speak more on this data in a few minutes. As well, during the Omicron wave, many Canadians contracted COVID-19 and are now unable to receive their booster dose until 3 months after COVID-19 infection, as Health Canada recommends. So this could be another contributing factor to the low booster uptake due to the spike in cases in especially January and February of 2022. So many patients might just be waiting to get their dose, and it's important to communicate to them about that. And finally, a lack of understanding of the risks of new variants could be another factor in low booster dose uptake. A Globe and Mail article cited many Canadians were questioning the urgency of the Omicron variant, especially as restrictions were easing up. However, it's important to note that the daily percent positive over the last week has been 19% in Canada, and it has been continuing to increase over the last few weeks. So this demonstrates the risk of a new peak and the importance of receiving the third dose. Excuse me. So taking a look at the efficacy of boosters, as we keep in mind the current landscape of vaccine apathy, looking at booster efficacy data and then relaying this information to patients can be a big pushing factor to increase the booster uptake. Taking a look at benefits of the third dose, a study conducted by the CDC and published in January of 2022 looked at 88,000 hospitalizations across 10 states during the Omicron wave and found that the booster dose was actually 90% effective at preventing hospitalization compared to only 57% 6 months after 2 doses. So this study also looked at 223,000 COVID-related emergency and urgent care visits and found that a booster was 82% effective at preventing these visits compared to only 38% 6 months after 2 doses. So a very limited new study by the CDC looked at only about 200 patients and found that third dose efficacy also did decrease against outpatient visits, dropping from 87% at 2 months after receiving a third dose to 66% at 4 months after. And a similar drop was observed against hospitalization as well, going from 91% to about 78% over the 2 months. That being said, receiving a booster is still the best way to effectively protect against hospitalization and ER visits. And with the rollout of 4th doses in the coming months, this will once again reinforce this immunity. So it's important to really relay this information to patients when having a conversation about receiving a booster dose, as it is very evident that the immunity wanes over time from 4 to 6 months after receiving each dose, and continued boosters are necessary. To further underscore the impact of this booster dose, a UK COVID-19 vaccine surveillance report found that with 2 doses of Pfizer or Moderna, effectiveness against symptomatic disease from the Omicron variant dropped from around 65 to 70% to only 10% after about 6 months. Similarly, if we see the effectiveness against hospitalization from the Omicron variant, it went down from 65 to 85%, down to only 30 to 35%. As we continue to move across the chart to the 3rd dose, we can see that receiving the 3rd dose significantly increases efficacy against symptomatic disease, hospitalization, and mortality after the immunity from the second dose has waned. And we can see slightly better lasting immunity after 2 doses when it comes to efficacy against the Delta variant. So, however, this immunity still does wane over the course of 6 months, coming down significantly from 90 to 99%. And this shows that receiving a 3rd dose of an mRNA vaccine once again reinforces the efficacy of the primary series.
Mm-hmm. And I know, Armida, that you underscored the importance for hospitalization and mortality, but taking a look at symptomatic disease too, like obviously you can attest to this having had COVID recently, and I think a lot of the people on the call can as well, right? That symptomatic disease is still very impactful, right? If we take a look at 6+ months after 2 doses, then you're getting very minimal, if any, protection from Omicron. And so that additional protection with the 3rd dose and subsequent booster doses can be quite important to patients that they might not realize, right?
Yeah, absolutely. And this is something I will speak about more later, but it's important to talk about how even when vaccinated, anyone can experience symptomatic disease. I myself had COVID recently, and I had all 3 doses, and I still experienced symptomatic disease and got very sick. And you miss out on school, work, life. So that is also a very important talking point to chat about with patients, that continuing to receive boosters is the best way to prevent complications and also hopefully shorten the time of the symptomatic disease. So they don't have to be in self-isolation for so long. Mm-hmm. Continuing on with this slide, data on continued immunity after receiving 3rd doses of mRNA vaccines isn't well characterized yet, but the studies show that it may likely follow a similar pattern of waning, which in that case, the 4th doses will also be required, like I just mentioned as well. But that is why the lines are where the data is not well characterized at this point in time. Another UK study looked at the efficacy against hospitalization following a Pfizer and a Moderna booster. So the study found that following a Pfizer booster, efficacy started at 90% and dropped to about 75%, 10 to 14 weeks after the booster, while a Moderna booster showed vaccine effectiveness of 90 to 95%, even up to 9 weeks after receiving a booster. So taking this information, though, regardless of the comparative efficacy, the importance of a 3rd and continual future boosters is established with this study, as we can see that immunity wanes over time with each dose, whether that is Moderna or Pfizer. A head-to-head study of US veterans 18 plus compared the efficacy of Moderna and Pfizer against risk of infection, hospitalization, and mortality, and found that administration of the Moderna vaccine showed slightly higher efficacy, but substantially higher longevity of efficacy. So this table shows the percentage difference of efficacy comparing Moderna to Pfizer at different time intervals following up after the 2nd dose. So for example, following up 45 days after the 2nd dose, Pfizer's efficacy against risk of infection, for example, was 9% lower than Moderna, and so on. So this shows kind of a comparative efficacy. Both are still effective, and patients should receive the first vaccine that is available to them. But it is a good conversation to have where patients may be showing vaccine choice potentially. And with mortality, there really is no significant difference, and both are highly effective. Now, many patients may be wondering which vaccine should they receive for their third dose, especially if they had received viral vector vaccines previously. And while there are many vaccines out there, patients may have questions about what to get for their next dose. Health Canada and NACI recommend the use of mRNA vaccines if no contraindications exist due to strong and well-established safety and efficacy data. That being said, even if a patient did not receive an mRNA vaccine for their primary series or received a mixed combination, they're encouraged to receive an mRNA vaccine for their second or third or any other booster dose. Some data included an observational study of healthcare workers, which found that mixing doses of AstraZeneca and Pfizer series actually showed better protection, and a similar effect is likely observed for the booster. So a heterologous regimen may actually be more effective as well. And for individuals who received a homologous or heterologous mRNA primary series, any mRNA vaccine, either Pfizer or Moderna, is recommended for a booster dose. A US study in the New England Journal of Medicine established that outcomes of homologous or heterologous boosters comparing Pfizer, Moderna, and Johnson & Johnson found similar reactogenicity and safety in terms of the different regimens. And when taking a look at immunogenicity, the lowest immunogenicity was observed with the Johnson & Johnson homologous series. But looking at both the mRNA series, the immunogenicity was either similar or increased with the heterologous regimens compared to homologous regimens. So if patients are ever concerned about receiving different or mixed combination vaccines, ultimately, the bottom line is that an mRNA booster or primary series dose is preferred if no contraindications exist. Safety and efficacy profiles of heterologous or mixed regimens are similar to that of homologous regimens, if not more effective. And this is because the immunogenicity of heterologous regimens may even be higher or more effective than the homologous regimens. And ultimately, the administration of any booster vaccine will significantly reinforce immunity. So again, the first vaccine available is the best vaccine to receive, but it is a good point to mention that mixed dose series is still very safe and very effective. Now, moving on to next steps in COVID-19 prevention. So as positive testing rates in Canada have been increasing over the last week, fourth dose eligibility is expanding, even fifth dose, and there still remains gaps in booster and pediatric uptake. So it's important to engage and remind patients of the significance of continued vaccination in light of data proving that vaccine immunity does wane over 4 to 6 months after receiving each dose. Taking a look at some ways to engage patients for boosters, there are both passive methods and active methods. So some passive engagement methods would be displaying posters around the pharmacy to promote vaccination for boosters and children as a reminder to families coming in. As well, promoting the importance of getting vaccinated on your pharmacy social media, and having countertop displays for vaccination to encourage patients to book appointments when they come up to the pharmacy counter. Some active engagement methods are engaging patients as they call or visit for prescription refills, asking them if they have received their booster dose and if they'd like to book it. Asking something like, have you received your booster dose of a COVID-19 vaccine? Or inquiring about their children. Is your child fully vaccinated against COVID-19? And following up with booking them an appointment. Would you like to book an appointment right now? And if they have any questions or concerns, addressing those with data and helping patients really understand the importance of receiving booster doses.
And doing some of these things as well, like where possible, automating it using our phone systems, our web apps, or our appointment booking systems will be helpful for the workflow as well, so that you can try to get as much of that administrative stuff out of the way.
And taking a look at some counseling tips for a booster. So this is addressing really the vaccine apathy that we discussed before, with reported patient concerns regarding receiving a booster. We have developed some simple and short counseling tips when talking to patients about boosters and their choice in receiving one. So it's important to highlight that severe adverse effects are often rare, and the dangers of severe outcomes from COVID-19 far outweigh the dangers of common vaccine adverse effects. Another point to address is the terminology of a booster. So highlighting a summary of the data surrounding boosters and reinforcing the fact that vaccine immunity does not last forever. It wanes over time, and continual boosters are necessary to maintain that immunity. It's also notable to address vaccine preference and convey the importance of receiving the first available vaccine and assuring patients that mixing doses is safe and effective. Finally, it's no surprise that as restrictions surrounding masks and vaccinations have eased up, the positive test rates and cases in Canada are increasing. It's important to convey this information to patients, as the pandemic is unfortunately not over yet, and continued vaccination is the only way to prevent severe outcomes or even symptomatic disease in future waves. And also speaking about self-isolation and really expressing the difficulties that come with self-isolation that can pose a large negative impact on work and social life, and stressing the importance of receiving a vaccine so that patients, even if they do get sick or do have symptomatic disease after vaccination, hopefully their self-isolation period is shorter or their symptomatic disease is milder, and really stressing the importance of the impact that it can have on day-to-day life. As well, addressing the perceived risk for children. So teens and children still have a risk of symptomatic or severe disease, hospitalization, and death, and do need to receive their boosters as well to help protect them, especially as they go to school, and in the summer they're going to summer camp and different activities where they're engaging with other children and people and families. And finally, speaking on variants, stressing the importance that vaccines are still the best method of protection against new variants that continue to come out, and still remain the best protection in future waves that might occur.
Yeah, you addressed the variant issue as well in one of the past slides, Armida, where you showed the difference in efficacy between Omicron versus Delta. So there is definitely still efficacy against symptomatic disease, against hospitalization, against mortality with Omicron with our current vaccines. And I just wanted to point out again, like that perceived risk of COVID infection can be different in the eyes of the patient, right? Often patients hear from their contacts, from the news, from wherever, that COVID-19, once you've had your primary series, is a mild infection. But what they might classify as a mild infection can be quite different from what's scientifically classified as a mild infection, right? So mild is anything where you don't need hospitalization, right? So it can still be very serious, even for outpatients who get symptomatic disease.
Absolutely, yes, absolutely. And to summarize, Pharmacists play a central role in addressing the vaccine questions and targeting vaccine apathy to close the gap in vaccination numbers. So especially when it comes to COVID boosters and pediatric shots. As we highlighted earlier, the booster and pediatric vaccine uptake is quite low. And this is a relatively large gap in vaccination efforts because it is evident that many Canadians who received their primary series and are considered fully vaccinated did not go back for a third dose. And children and teens who received vaccine eligibility later than adults are also facing this gap in vaccination. So it's important to remind patients of new data, such as Moderna's new pediatric COVID vaccine, and prompt patients to book their appointments as they come into the pharmacy. The concept,
as well as the new data that we want to focus on about mixing vaccines, which we see, and you mentioned it before, Armida, a lot of vaccination choice from patients who want to stick to a particular brand or but we see with the evidence that there is that efficacy and that safety with mixing vaccines, either the same, if not more efficacious.
Yes, exactly. And the concept of the COVID booster is really only beginning. So pharmacists should highlight that the importance of getting boosted by reminding patients of the social and work impact of self-isolation, as well as the efficacy of boosters in avoiding infection and thus avoiding self-isolation if possible. As well, it's also important to target vaccine choice, as you just mentioned, Molly, reminding patients that the mixing vaccine regimens is safe and effective, and sometimes even more effective. And finally, highlighting solutions to vaccine adverse effects to maintain the patient's confidence in receiving their shot and having a point of contact if they are having those adverse effects. And finally, many studies are now highlighting how the immunity drops significantly over 4 to 6 months after receiving each dose of the COVID vaccine, with positive test rates that are increasing and new variants that are continually emerging. Boosters remain the mainstay for prevention and really the only way to reinforce immunity as time goes on. And it's likely more boosters will be needed over time. So pharmacists have this great opportunity to keep the interest up in the patient populations and continue to promote vaccination in your communities.
So we do have a question, Armida, from in the Q&A. When do you expect we will see vaccines adjusted to include variants? I know that we've all seen a lot of news from the various manufacturers that have looked into reformulating their vaccines to include some of the newer variants that are out there. I don't know if there has been, a date set or, I haven't seen any dates on when we can expect those, but probably, hopefully sometime soon. But in the meantime, the boosters that we currently have and the formulations that we currently have still offer protection against variants, which is what our main message here tonight is, to make sure that we're covering with patients. Hopefully we will see vaccines adjusted to include a broader range of variants, but we'll see as time goes on. Have you heard anything else about that, Armida?
I haven't heard anything specifically on a date or if that has if that's been done yet. But yes, like you said, hopefully over time that is included and adapted to include the variants. But as of now, the best chance that we have are each boosters that are being eligible for different groups, just reminding patients when they are eligible and to book their appointment.
Yeah, another interesting question came up. So is it better to wait and get boosted closer to the fall when we expect another peak in cases? What do you think about that question, Armida?
So I would say it's better to get boosted as soon as you can and as soon as you're eligible, because as we can see, the immunity does wane and positive test rates are going up, and we are technically not in a peak season right now, as it's not the fall and we're entering into the summer, and yet case rates are going up, and even just in the community, many people I speak to have gotten COVID, gotten sick, people who are young, healthy individuals. And I think receiving the booster dose can really prevent that. And as we open up for the summer and there's not really a vaccine passports or masks and in a lot of the public spaces, I would say that a lot of patients and the public are actually might be more at risk as the weather is getting better, they're going out and interacting with more people. I think it's best to get boosted as soon as you can. And likely there might be another booster by the fall anyways, if we take a look at the timeline.
Yeah, I definitely 100% agree with you there, Armida. It's hard to predict whether or not you'll get infected by COVID. So I think number one is to get your booster and be protected as soon as you can to make sure that you stay healthy. Because even patients who, have gotten COVID, they get long COVID, there might be complications down the line. We want to prevent that, right? And also last summer, there were a couple of studies that looked into the seasonality of COVID and whether or not warmer temperatures would disrupt the virus or make it less likely for it to transmit. And I think, the benefit of summer is that there's more outdoor settings. So instead of being confined in a room, you'll be outdoors. So the risk of transmission might be lower that way. But then, as Armida said, there's that added risk of more people gathering, right? And more gatherings in general. So it may even out. So I think definitely the message is still to get boosted as soon as possible. So good question here. How long after a COVID infection should a patient receive their 4th dose? What do you think about that?
Yeah, that would be 3 months. I don't know if it may be different for immunocompromised populations, but in general, the recommendation from Health Canada is 3 months after testing positive or having COVID-19 infection.
Yeah, so NACI released some specific recommendations about timelines, and there is a little bit of, they discerned a little bit between immunocompetent versus immunocompromised patients. But as Anita said, for most patients, they do recommend waiting the 3 months just due to, how the immune system works and how long antibodies last in our bodies. So they do recommend the 3 months. Certain provinces may not follow that. So it may still be up to the patient discretion and up to your conversation with them, because some provinces will definitely allow you to get the booster dose as long as you're no longer infectious or as long as you no longer have symptoms. So patients may still get the booster dose before the 3 months, but it may be good to educate them that they may have an increase in immunogenicity if they wait. Any idea where the Novo Nordisk plant-based vaccine is here in Alberta, here in Quebec, and BC are using it already? So with the plant-based vaccine, that's the Medicago vaccine. I can't say specifically for Alberta. I know that, it's not really widely used across Canada at the moment. There were some issues with the World Health Organization not fully recognizing it. And if that occurs, there can be issues with patients, traveling to different countries who listen to the World Health Organization in terms of their vaccine requirements. Do you know anything else about that, Armida?
No, I don't know anything specifically about whether it's available for use or not. I haven't heard too much on it or seen too much of it, so I don't know how prevalent it is being used. I imagine the other vaccines would only be used in a case where there is any contraindication to an mRNA vaccine.
What is the approved time interval between the 3rd and 4th doses? So it can vary by what your jurisdiction is recommending, but in general, it is about, I believe, around 5 to 6 months between 3rd and 4th doses, although there is usually a little bit of wiggle room with informed consent for patients. at least 3 months. Oh, and somebody answered that 140 days in Ontario. So yeah, it can vary based on your province as well. Well, so we got a question as well. Since the Pfizer is still the preferred vaccine for age 6 to 11, according to NACI, how can we convince parents to choose Moderna for their kids? Their concern is that if the Pfizer is preferred by NACI, why should we choose Moderna? They are most concerned about its safety in the long term. I think that's a really great question. And, you know, listening to NACI as well, we do want to prioritize the Pfizer pediatric vaccine for those patients who are 6 to 11, just because it is, you know, we do have confirmed safety data for it. That being said, if there is a lack of pediatric vaccine or if it's not readily available, then Moderna is equally can be recommended for those patients. I think the number one thing, it's again back to patient vaccine choice, right? We want to make sure that we get patients vaccinated as soon as possible, because even with each passing day, there's a risk that they can be infected with COVID. And so to answer that question, I think, you know, if the Pfizer vaccine is available at the time, then it definitely is recommended and is the preferred option. But say that vaccine is not available to parents, then they should definitely consider Moderna, which has been proven to be safe and effective within its clinical trials as well. And you can also mention that it has been reduced in dose based on what was the original strength.
Yes, and if
Anything
I may
else to
add
add?
something, yeah, all the safety data and everything. Thank you, Molly. I think it's also important to kind of emphasize to parents that children, you know, especially over the summer, are going to be going out with their friends to summer camp, to different activities, sports, whatever that may be, and it's the safety risks or the safety concerns are much more minimal, considering the really, really high risk that those children have in having symptomatic disease or even bringing COVID back home. So being able to receive any pediatric vaccine that they can would take priority over over the potential risks that there might be on with the Moderna vaccine or any safety concerns that there may be.
We had another question here, Armida. Any data on ages 5 to 12 having 2 doses across Canada?
Oh, ages 5 to 12 having 2 doses. Yeah, I think, yeah, let me go back to that slide. So 39% of the population, 5 to 11 years old, are fully vaccinated at this point. So that is 2 doses. So that is the data for that.
Have you seen any efficacy and data around for that age range, Armida, that you've seen?
Efficacy of 2 doses?
Yeah.
So not efficacy specifically. I didn't look too much into that, but just taking a look at Moderna specifically, which is what I looked into more here. The efficacy for the Moderna vaccine for 6 to 11 is comparable to that of 18 to 25. So taking a look at efficacy over here, for the Moderna vaccine, the efficacy is 94% effective in ages 18 plus, 100% effective in ages 12 to 17. And those numbers are comparable in the 6 to 11 age group. So similar efficacy in the pediatric population.
Mm-hmm. And also high efficacy for the Pfizer vaccine too.
Yes, exactly.
Okay, any other questions? Please feel free to put it in the chat or the Q&A.
Thank you for your kind message, Madison.
Okay.
Thank you, James.
Okay, so actually, there is a feedback form that if everybody has the chance, and this is my bad, Armida, I should have sent it out a little bit earlier, but I've just put it in the chat now. If you're still on the call and you have a minute to fill out the feedback form, please direct your browser to the link in the chat box. We really appreciate your feedback, and it really helps us out in developing our continued educational programs. So fill that out. I'll also send out the slides, so no need to take screenshots of the slides here. I'll send out the slides to everyone at the end of probably by tomorrow morning, as well as the recording. So please fill out the feedback form and you'll get the slides I'm recording tomorrow.